Earlier this week, President Obama announcing 3,000 military responders will be sent to Liberia to respond to the deadly Ebola crisis plaguing West Africa. Tell us more about that virus. We have Ebola researcher Dr. Alex Lara. Thanks so much for coming in. This is on a lot of people's minds right now. So you were over at UH talking about that. Tell me about that.
Yes. Good morning. First, I typically am not up this early, so so it will be a little bit difficult. We were actually having a seminar yesterday to inform medical students, the faculty. There's a lot of concerns about Ebola these days, sure. And so we were just trying to bring people up to speed. What we know, what are the latest findings.
So it's only natural for people here to say, gosh, is it going to come to Hawaii?
The likelihood of it coming to Hawaii due to the distance to the area of the outbreak is not very great. However, if anything was to happen, and this is something that we were assured of yesterday as well, we had representatives of the military, we had representatives of the State Department of Health there, and also an infectious disease specialist from Queens, and everyone assures that they know the proper infection control practices. Right. So if somebody was going to get sick with unclear symptoms and with a travel history to Africa, they would be absolutely ready.
And you know, something important to talk about that we mentioned is sort of what this sort of is like, because I mean, I think people typically think of the cold or the flu, how that transfers, but this is different. It's not like you're not going to know that they're sick and then you might catch Ebola. Explain how it's different.
The difference is that in the early phase of the disease, it is a typical normal viral disease with sore throat, and it is not contagious at this stage. At the stage when the more severe symptoms show up, where profuse bleeding and things like that can happen, that is the phase when you know absolutely that the person is sick and that the person needs to be isolated.
Now you're doing some work on a vaccine.
I actually have been working on a vaccine for over 10 years here. I started that at Hawaii Biotech when I was still in private industry, and we actually have made good progress on getting to a promising candidate. Obviously, a lot more work needs to be done because it is a very expensive development process.
No doubt.
But we keep up working on it.
Well, we're glad you keep working away at that. Looking forward to keep in touch with you on your research. Thank you, Dr. Lara, for coming in.
Okay, thank you.
Important stuff.